Evening to everyone. We have about 1 minute before we officially start. If you would go ahead and place your name and campus in the chat. So hopefully everyone is doing well. On this May 28th, we have this time is just moving. But I warned you all, after you take that first exam in your classes, the time just goes by really fast. It's the same time, but it just seems like it speeds up. So we will go ahead and officially start. Just as a reminder, these sessions are recorded and they are viewed by the attendance administrators. Ensure that you're on camera unless we're on a break, and just make sure that you place your name and campus in the chat. Ensure that your name appears how it appears on Fortis's roster. In the event that you need to change your name, you click the little three dots, the little lists, I think is what you call them, and it allows you to rename yourself. So welcome to week 8. So we are over halfway the term. Let's look at our modules. Our Canvas here, so we can see where we're at and where we're going here. So we did take our Unit 2 exam on last week, which was week 7. So we'll go back and look at that content. So we are in week 8 now. We will have a quiz today. So for sure by the end of week 9, probably the beginning of next week, you should start receiving, and this is for all of the courses that you're taking, HESI information. Remember, HESI information is specific based on your campus. So if you and I go to a different campus, information that I might share with you more than likely might be a little bit different from what you're hearing on your campus. It is campus specific. And so we have exam 3, which is in week 10. If you have more than one course, remember, week 10 is another one of those weeks where if you're having more than one course, more than likely you're going to have 2 exams in that same week, if not that same day. So just keep that in mind. And then for week 11, you have your HESI. So remember, too, HESI weeks for all of your courses, they are campus specific, and usually they're not held during your night class time. So, just make a note on your schedule that, work, family, you may have to rearrange, delete, put some things on pause because it's more than likely we haven't given HESIs during this time of night. So that week is going to look different because it's going to be based on your campus as well. And if you're taking more than one course, you may have HESIs on the same day, same week. So if in the event that you need to have a conversation with your campus dean, make sure that you do what you need to do to be proactive with you being successful in all of your courses. This HESI prep assignment is not due until week 9, which is next week. Hopefully you have been reviewing those topics. Is an assignment, but it's twofold. Well, it's really threefold or fourfold. It helps you provide that best care that you're going to provide for your patients once you become a nurse. And it's going to help you critically think and think through, because remember, you're using Apr to answer and to talk about each one of those concepts. Then you're going to sit for your NCLEX, pass it on the first try. Then you're going to, of course, pass your HESIs because you've been prepping all along with these different topics. And using that Apr, it's just a good, tool to use no matter what concept, no matter which course that you are taking. What are those assessment findings? What are those that patient teaching? What are those things we should be planning for? So let's see here. And then week 12, you have to do your remediation. And then we do meet on week 12, I believe, but we'll let you know because usually the campus is closed on that Wednesday at a certain time. But if there's an alternate schedule, we will definitely let you know. Your HESI score is not valid unless you complete your remediation. That's for all of your courses. So that's just repetitive information there. So we are in week 8, but let's back up and let's talk about week 7. We had infectious disease, preventing infectious disease. So let's look at the content here. Let's talk about it. So I'm going to talk for a few minutes and then let me know if if there's a topic or something that I need to discuss more. Oh, let me go into this right here. So remember week 7, and then hopefully you've been following along and opening up your announcements. Let me go to the announcement section here. We put a lot of resources in that announcement section for community. A bunch of them. So let's see here. So if you're looking for your exam 3 information, remember we usually post it prior to, so you'll have it in a good amount of time. So of course that's week 7 information, but here you already have your study guide here for exam 3, which is in week 10. Okay. All right. So let's talk about a little bit of information here. So for week 7, infectious disease prevention and control. So if we're talking about preventing something from ever occurring, which level of prevention is that?
Primary.
Okay. All right. And then if we're trying to control the disease, whether we're, first of all, let's see if we're trying to control it by giving tests to see if someone has that disease process. What is that? Which level?
Secondary.
Secondary.
Okay. So we have an outbreak. People are sick. We're giving them medications. We're pharmacologic agents and non-pharmacologic agents. We've got support groups for them. Which level is that?
Tertiary.
Tertiary.
Okay. Tertiary. Good. So we have infectious disease prevention and control. Then we have the concepts, the disease processes is HIV, tuberculosis, sexually transmitted diseases, viral terrorism, and disaster. So, we have that triangle consists of the host, the agent, and then the environment. So we have to have all of these things that in place in order for or an alteration in it, as I say, in order for infections or for diseases to actually spread. So let's talk about immunity first. So we have what we call passive immunity, and then we have acquired immunity, and then herd immunity. Herd immunity is, well, let me just hear from you. Put in the chat, just select one of those immunity that you have the better understanding of, and then I'll sum it up. We'll give you a minute. So we have passive immunity, acquired immunity, and you can give an example or a definition of what it is, and then we have herd immunity. So put my little timer on here, 1 minute. You can give me an example and then share it out so everyone can see, or a definition, your paraphrase definition. A minute to be up before I get to my little timer here. Okay, here we go. Start. So let me see what you're putting in the chat. So again, you can select one, or if you can select all 3, but at least at a minimum of 1. Give us an example or give us a paraphrase definition. We are talking about the different types of immunity: passive, acquired, and then herd. So just kind of think now. Remember we talked about some words. Root words can tell you or kind of lead you. I'm giving an example of what it actually means. And you have your minute is up. Okay, let me look and see what you got here. Okay. So herd, everyone is kind of like, it's a large number. So the people receive their immunity because there were a large number of people involved, and those people already had whatever it is, the disease process that we're talking about. So the others develop this immunity. Good. Okay. And then passive, it's, that word kind of gives you an idea. It's from one person to the other. So good example, from the mom to the child. Good. And I don't think anyone said anything about acquired, but acquired immunity is disease from a previous infection, or a vaccine. So you acquire it by either having that disease process and you build up those antibodies yourself, or you get a vaccine that helps you develop those antibodies. So then disease processes, we talk about transmission, horizontal and then vertical, vertical, horizontal and vertical, horizontal and vertical. So horizontal is person to person. And then vertical can be from mother or father, and they pass it on to their offspring. Okay. So when we talk about the disease process, we got to think about, we'll talk about it more once we get to the HIV infection, where there's this incubation period. There's this time interval between what we call it an invasion by that infectious agent, and then when it actually appears. And then what we're talking about, when it actually appears, we're talking about those signs and symptoms. So a person could have been infected with a disease, but then it doesn't show up until later on. And that's that incubation period. The communicable period is an interval during which infectious agents may be transferred either directly or indirectly. Like indirectly is where, there's a surface or something that person comes in contact with, but it's not person to person. So direct is person to person, but indirect, it is a something else, an object or something that a person may come in contact with, and they may end up with that disease process. Any questions so far? Those different types of immunity. We talked about transmission, that incubation period, and that's really important, and then that communicable period. So an epidemic means the occurrence of a disease within an area that is in an excess of an expected level. And so we've heard about epidemics, outbreaks, endemics. And so the endemic is not as large as the epidemic. That's how I equate them. So the endemic level of disease is the amount information, that event that's occurring, that disease process that are occurring in that population, provided the baseline from establishing that health problem. So it's not as large as that epidemic is. Epidemic is just widespread. So we want to remember, like, when we talk about indirect and direct, what is it that we come in contact with, no matter what age you are, what race you are, no matter what religion you are, what are those things that we come in contact with, that everybody comes in contact with? Water, our airways. So we want, and then like, if we're all in Walmart or at the grocery store, the things that we're all touching. So we need to think about that as we think about preventing the spread or even the occurrence. So, but what is that one? And I need everybody to respond in the chat. What's that one thing that they said we can do? That single most thing that we can do to prevent or to help infection control? Let me see what you're gonna say in the chat. Is that one thing? Despite all of these immunities, getting vaccinations, providing education, yes, everybody's on it. It is that hand washing. So we do know that they created that hand sanitizer, and be careful with that, because you want that certain percentage. Because if the percent of alcohol that's in there, or that other agent, I forget what it's called, if it's not a certain percentage, then it's not as effective. But when you can, no matter if hand sanitizer is available, you do want to wash your hands with that soap and water, making sure that you're getting that good friction for that time frame, and that you're rinsing and then drying well. Yes, hand washing. Okay. So there are some surveillance of outbreaks. I guess we're going all over the place now with keeping up with numbers. And the CDC was usually our main, and the WHO were like our main sources of keeping up or letting us know, well, hey, this is what's happening in this area. And so I know we're, having some different information or guidance about, who tells us that information now. But there is a such a thing, or there was a such a thing where there was surveillance, where these things were kept up. We talked about it early on about those reportable diseases and things that are reportable. And so each state has their own list. And so that information is sent out to the different health agencies and is kept up with. And then it puts out warnings or gives us guidance as what to do or what to be looking out for. So vaccines are one of the most effective methods of preventing and controlling communicable diseases. So since the 1900s, communicable diseases were like the leading causes of death in the United States. But since that time, there have been improvements in sanitation. Nutrition has improved, antibiotics, the discovery of them, and the development of vaccines have ended epidemics that were once known that were caused by diphtheria, typhoid fever, and tuberculosis. So vaccines and then it just changes our knowledge base has helped with decreasing to certain diseases you just kind of rarely hear of because we have that knowledge base of things that we can do to try to prevent it. So diseases such as polio, like I said, diphtheria, pertussis, and measles, which previously occurred in epidemic proportions. They occurred in large numbers. Now you rarely hear. I know we're hearing a little bit more about measles now, but prior to maybe like a couple of years back, you rarely even heard of measles and you don't even hear of diphtheria and polio. They have not been totally eradicated. So children need to still be, we're not for vaccines or against vaccines, but that information is there. And the evidence does show that does has helped, including the other things. In the United States, no shots, no schools legislation has resulted in the immunizations of most children. Of course, you have your exemptions. You can have your medical or your religious exemptions, but for the most part, for most of the vaccines that are recommended, people, comply with them. Now, there's some that some don't want. It's fine, but the evidence is there. Children from religious communities and whose beliefs prohibit immunizations, and children with parents who have any type of objection to immunizations they have that waiver. Okay, so now they have, I would say, how long have they been promoting the HPV vaccine? Really not sure. It is, I don't want to say it's new, but it's fairly new compared to the other vaccines. But with the HPV vaccine, the vaccine protects against the most prevalent infections. So it's sort of like the flu vaccine. I know you probably heard of people saying this, and you might have even said it yourself. I got that flu vaccine. I still got the flu. Well, what's in that vaccine is not protection against all the strands of the flu. The HPV vaccine is the same. What's in the vaccination does not protect you against all of the strains, but the most prevalent ones. So, can someone get the HPV vaccine and still end up with the disease process? Yes. Because if whatever that strain that they come in contact with, if they don't have that built up immunity or protection from it, then they can still end up with it. Hence the same thing with the flu vaccine. So it does not protect against all. So that is one of those words, those test taking tips when you see all and but most. So you want to make sure that you're reading and answering appropriately. Okay. Because the HPV vaccine, HPV disease is just one of those diseases that has so many different strands to it. Okay. So we have HIV infection, hepatitis, TB, and STDs. So sexually transmitted diseases are a major health challenge in the United States. Um, the bacterial infections, they include gonorrhea. We're talking about syphilis, chlamydia. Most of these infections are cured by antibiotics. The exceptions are the newly emerging antibiotic resistant strands of gonorrhea. There are some strands that are resistant to it. So for chlamydia and gonorrhea, bacterial is spread through sexual contact. It's treated with antibiotics. All sexual contact should stop until the treatment is complete because there is a risk for reinfection in the event that the person is, not completely treated if they continue to have sexual contact. All sexual partners in the last 60 days should be contacted, tested, and treated. With those, chlamydia and gonorrhea, there can be no symptoms. That person can be asymptomatic. And it also can cause PID or pelvic inflammatory disease, which can lead to infertility, endometriosis, and it also can lead to death if not treated. So it's important that all sexual partners be notified, contacted, tested, and also treated. Syphilis, it begins as a painless sore, or they call it a canker, and that's that primary stage. So syphilis has these different stages. We need to know the different stages and what occurs at those stages. So again, they have that primary stage of syphilis. There's that sore, and it can be painless. Then it moves on into the lymph system, and the person starts to experience flu-like symptoms. That's that secondary stage. If not treated with antibiotics in the primary or the secondary stage, then it can become latent or in that tertiary stage, and it can cause severe damage to many of the body's body systems. Okay, and then at that stage, it is no longer curable in that third stage. So, again, notifying the partners, getting people tested, and doing the treatment. So that secondary stage, how do we know that person has progressed on to that secondary stage? You said primary stage, they have those signs and symptoms. But that secondary stage, it's going to be a blood test. And doing that blood test is going to come back positive. So that positive, another word for a blood test or getting blood drawn is serology. We draw the serum. A positive serology, you need to know this, indicates that the syphilis has progressed to that secondary stage. So that is that screening test that is done to say, yes, this disease process is there, or no, it is not. So blood is drawn, a blood test is done, also called serology. If the disease process is there, it's called, the result says are positive. Okay. So herpes, simplex, and then genital herpes, viral, and it's incurable. It starts as blisters around the genitals or wherever the contact actually occurred. Those blisters may ulcerate and last for several weeks. And then the virus moves into the nerves and reactivates repeatedly. So people may have outbreaks. Okay, but it can be suppressed with those antivirals, not antibiotics. Clients with genital herpes should inform their partners of the disease to help prevent the transmission. Petroleum products should be avoided because they can cause the virus to spread. Okay, so we talked about herpes, syphilis, chlamydia, and gonorrhea. Are there any questions about those concepts? Okay. Let me look in the chat and make sure not missing any questions or comments. So next we're going to talk about hepatitis. Okay. So that's a viral attack on the liver. Okay. So hepatitis A is spread through fecal oral content. High-risk men who have sex with other men, daycare workers, and their attendees, illegal drug users like using medicines that are passed around with the needles, those from countries where hepatitis A is common, vaccines available for those at high risk. That's hepatitis A. Hepatitis B is bloodborne, and those that are high risk for acquiring hepatitis B are IV drug users because they're sharing that needle, persons with other STDs or multiple sexual partners, because those body systems, if there's already a disease process on board, then that body system is going to be weakened. And then the multiple sex partners, because they're we're not really sure of what the others are doing, and everybody's sharing, and it can lead to hepatitis B. So those other places, like long-term care facilities, such as like correctional facilities, healthcare workers, we are at an increased risk of coming in contact with the hepatitis B virus. It can live on surfaces for a week. That's that indirect contact. So now they're starting to get the vaccine at birth. And then healthcare professionals, they do offer that series of vaccinations as well. And then after you get the series of vaccinations, you can take the titer to see what your levels are. Hepatitis C is also bloodborne. And of course, the high risk populations, those that share IV, drug users. So anything that compromises your judgment or puts you at risk for that direct contact, that blood, anything blood or body fluids, that's going to be those that are at higher risk because it's bloodborne. So infants of infected mothers, they are at risk for acquiring hepatitis C as well. So 85% develop chronic or lifelong infection, which can lead to it damaging the liver. It can lead to liver cancer, liver failure, because it just causes it that organ not to function as it should. So hepatitis B infections can be prevented. That's with immunizations. So went through A, B, and C. A is spread through fecal oral, B is bloodborne, and then C is also bloodborne. Okay. The HIV virus, human immunodeficiency virus, is bloodborne infection spread through sexual contact, sharing of needles. It can be vertical from the breast milk to the baby. Used to be spread through blood transfusion. It used to be, but blood now is tested. I forget what year that was that they, started testing, but now the blood is actually tested. And then after needle stick injuries or even if there've been some type of high risk exposure, then there should be testing repeated every 3 months. Because with the antibodies, if a person has actually been infected, those antibodies, the way that virus works, it doesn't show up until after 3 months. That person can get tested today. It can be negative. But in fact, if they really have been infected, they'll need to still continue to test. That 3-month mark is going to be the test that you're going to want to look at to see if it's negative or positive, because it takes that virus 3 months before it actually, it can take up to those 3 months or those 12 weeks before those antibodies actually show up. So yes, you want to test in and just keep on testing. So re-education, we need to encourage our patients, to continue testing, follow-up testing. Okay. Are we clear on about why that testing is necessary to be repeated? Okay. So tuberculosis, like we said, that was one of the diseases. It hasn't been eradicated, but the numbers are really, really low because, we screen for it. And so if a TB skin test is positive, so initially we do that, the education. Then if we're trying to determine or detect that we do the TB skin test or that PPD test, or they call it the MEN2 test. If that test is positive, we do want to ask if there have been any recent exposures. And then we want to set up HSX-ray, or they can do a blood test to determine if that is a false positive or is a positive positive. Now, if we're taking care of a person that has active tuberculosis, part of our PPE, our protective personal equipment, is that N95 or that particulate filter respirator. We shorten it and say the N95 mask, but it's also called a filter respirator. N95 and the way it's made different from those. I think by now pretty much everyone is, even lay people are familiar with the N95. Is built, it's made up so much different from those regular masks. So an N95, a particulate filter respirator, is worn by anyone that's going to enter that room of that patient with that primary tuberculosis. A private room is preferred. The patient should only leave the room for essential activities with a mask. So, some tests can't not be done at bedside, and that patient will have to go down or to another floor to have a test or something done, but they shouldn't be just going out to the gift shop and, hanging out in the visitor's lounge. So we want to keep them in that room, and they usually have that negative airflow as well. Okay, I'm going to pause. Are there any questions? Look in the chat. The next thing we'll talk about is bioterrorism and disaster management. So disasters are either labeled as natural, which we're having a lot of those now with the different weather events that we're having, or either man-made. So natural disasters, some examples are earthquakes, communicable disease epidemics, droughts, hurricanes, tornadoes, and we can even include flooding in that because of all the rain that we're having. The flooding is causing problems where people can't even get out of their homes. Man-made disasters are events that are directly human created, such as pollution. We have the businesses and the industries where they're supposed to, their waste products are supposed to be disposed of in a certain way, whether or not it's putting extra filters on whatever, however the pollution is, goes out from that industry, or if they're letting out, if it's a liquid form, are they storing it in these containers, and how are they disposing of these containers? So those are man-made disasters. Even I guess it's about 2 years ago, we were having, seems like a lot of trains were derailing. And some of the trains that derailed were actually transporting some type of chemical. And I think in one community, there was like a waterway, bodies of water that were nearby. And so that would be a man-made disaster, because what do we all have in common? That water, the air. So the Healthy People 2030 objectives for disease mitigation focuses on preparing. As a matter of fact, the Red Cross people, they've been out, asking for volunteers, and I don't know how far you all's clinicals go, but they have, because that's usually like that first line of contact when there's some type of disaster. They're transitioning to hurricane preparedness now, and so they want people to be prepared. Just have that knowledge base. Be alert that, hey, this is hurricane season, or this is whatever season that it is, and so that we can start to prepare, because things can happen where we don't have that running water or access to running water, power. And so what do you do for food? What do you do for water to have clean running water? And we're going to talk about that now. So in the chat, tell me what are at least list at least one thing that we can do, or a person can do, to prepare water safe for drinking. What's at least one thing that you've heard of? Let's do it. Give you a minute. What is that one thing that we can do to make water safe in the event that there's some type of natural or man-made disaster. What can we do to render that water safe for drinking? Okay, I want to see what you're putting in the chat. Got about 40 seconds left. Okay, got boiling tablets. I think I heard about those tablets. I forget, someone told me I think they were on Amazon or something last term. I think you meant to say filters, yeah. Okay. So go ahead and place in the chat. What can we do? So water can be rendered safe for drinking by boiling it for 3 to 5 minutes. We can treat the water with household bleach by adding 1 cc, which is 16 drops, which is a very small amount of household bleach, and then letting it stand for those 30 minutes. We can even think about it. The hot water heaters. That water is just sitting there waiting for us to use it. That water hasn't been used yet. And then it's also sitting in the commode tanks as well. Not the bowl part, but the tank part. So 3 things: we can boil the water for 3 to 5 minutes. We can add that 1 cc, which is 16 drops of bleach, and we can remove that water from the heaters. We don't like to say it, but we can also remove from that the hot water heater, but we can remove it also from the commode tanks as well. Okay. So allowing water to sit for 24 hours, pouring water through linen, layers of cotton towels does not make that water safe for drinking. So again, allowing the water to sit for 24 hours, or pouring it through those layers of cotton, that's not a filter. That's different from a filter. Does not make that water safe for drinking. All right. So bioterrorism, we have anthrax, smallpox, and then sarin. Sarin, we need to be all hands on deck respiratory, because that agent is going to paralyze the respiratory system. So just think about all those things that we can do to help assist someone's respiratory system. Of course, we check in respiration, listen to those lung sounds, measuring the O2 sat, administering supplemental oxygen. That person they may even have to call that person and put them on mechanical ventilation, breathing treatments. But sarin is an agent that paralyzes the respiratory system. Smallpox starts with flu-like symptoms. There are so many disease processes that actually start with flu-like symptoms, but smallpox develops this rash with red spots that become deep pustules and leave craters. The lesions of the smallpox, don't confuse them with chickenpox. Smallpox those lesions can be found in the palms of the hands and in the soles of the feet. Chickenpox do not appear on the palms of the hands and the soles of the feet. So now chickenpox starts with that rash. There's small little red dots that turn into small, either clear blisters or vesicles. But with in order to tell the difference, the smallpox is going to be in the palms of the hands and also on the soles of the feet. We need to know that. Okay. So anthrax, again, all things respiratory. We want to just make sure that we are, and if we want to report these things, if we have people coming in and we suspect, we don't really know, we want to report them to the authorities so that there can be, a quick investigation done, because we'll need to start quarantining, shutting down areas and, putting on that extra level or that appropriate PPE. So we did say that washing our hands is that single most thing that we can do to prevent the spread of infection. But when we're talking about foodborne illnesses and food safety, of course, we want to wash our hands before and after handling food. We want to make sure that we're separating raw and cooked food. We want to even use separate equipment and utensils. We shouldn't be using the same utensil without having it washed, that we've used for raw food and cooked food. So where are we gonna thaw? If we have some frozen food, where should we set that food at to thaw out? So come off mute and someone tell me. Should we put that food in the refrigerator or should we put it on the countertop to let it thaw out?
Can
It's
you repeat
frozen.
the beginning of the question,
Refrigerator.
please?
On the fridge.
How
Refrigerator.
should, yes, how should we, what's the appropriate way to allow frozen food to thaw out? Should we put it in the refrigerator or should we place it on the countertop at room temperature? And I agree with you all. It should be placed in the refrigerator to thaw out. We want to cook food thoroughly. Do not attempt, we do discourage from eating meat that is rare or that has not been cooked thoroughly. And, don't use beyond that expiration date. Sometimes, even with that expiration date on there, you will still open up a pack of something and you're like, wow, let me take this back because it's definitely expired. So, Emily, did you hear the question?
Yes, miss. Thank you.
Okay, you're welcome. So waterborne pathogens usually enter the water supplies through animals or human fecal contamination. Like, how in the world is this getting there? It's usually through that fecal contamination. And so we just want to make sure that we're using the appropriate filters and everything, and that the water companies, they're supposed to be using whatever those formulas are to keep our water safe, and so that those things are eliminated from our water sources. So we have vector borne. These are Lyme examples. Is Lyme disease carried by deer ticks, and that Lyme disease is that those ticks can be on a person for a long time and they don't really realize it on there. So for those that have like do camping trips or even just being outside, it's being summer months, if those lawns or those at the parks have not been treated, then we want to make sure that we're encouraging inspection of that skin, because those ticks can be on someone and they not know it. And over time, it will cause Lyme disease, and that will cause harm to that person. Any questions about infectious disease prevention and control? We talked about HIV, tuberculosis, STDs, and bioterrorism and disaster. Any questions? All right, let me see then. Let's see. I'm gonna try not to say anything. Let's change gears here and go to our Kahoot. I had it pulled up here. Okay, I think this is it. All right, so get ready to go to Kahoot, and then we'll take our quiz here before long. Okay, where'd it go? Oh, here it is right here. Okay. So we'll just do the game part first, and then we'll do the flashcards. We'll talk through it, and then we'll take our quiz. And let me share my screen. Excuse me. Uh-oh. Oh, okay, there it is. Oh, I got this little pencil going. It's gonna stop sharing and reshare. I'm not sure what I clicked on that thing. Okay. All Okay, think about what diet you just recommended. This is asking, should we evaluate and look at the environment for someone that is at fall risk? Just wanted to know why you did not select an on and off lung condition.
Because it's chronic, so it means long term. So it's always going to be there.
So exactly, it's not like the flu. We get it and we treat it and go away, or a cold. Exactly. All right, good, 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 good. What's wrong with this one? The red one.
It says large instead of small.
Exactly. Because remember, a person, and I said I wasn't going to talk, I was going to wait till the flashcards, but a person that has COPD has a problem with moving that air, that gas exchange. And so they're going to need to rest up. They need to make sure they've done everything, and not being rushed while eating. Because what's going to happen is they're not going to eat their food because they're more focused on catching that next breath because they're short of breath. So eating these large meals, they're more than they'll be good to even finish the meal, the regular size meals, because they're more focused on getting that next breath. So having large meals, they're not even going to want to eat that food. So then it's kind of like dominoes. Then you start to see them losing weight, and then that leads to something else. So we do want them to rest up before starting meals, and they can have smaller meals. May even need snacks in between. For sure, we're not telling them to take their oxygen off because this is a disease process that has a problem with gas exchange. So they're needing that oxygen, and if they're going to take it off, they're sure not going to just place it, just take it off while eating because they're going to need it. So good, 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 good. Let's see. Does smoking increase or decrease our blood flow? So we want to prevent from coming in contact with whatever that chemical is. So the patient might have to irrigate their eyes. It just depends on what exposure. If they have contact lenses, they should be removed and thrown away as well. Their clothing should be placed in a bag, and we need to avoid touching those clothes because we were talking about a chemical spill. So we want to make sure that we want to have an extra layer. Of course, we're going to have all our other PPE on, but we need to also use tongs to make sure that we're touching those clothes rather than our gloved hand. So this question was supposed to be after the previous one. So we talked about smoking. You all told me that it did something to the blood. But then the next question was PAD. What is that disease process? That's that accumulation of fat in the bloodstream. So with PAD, Is the blood flowing like it should in our veins and arteries and those blood vessels? No, it's not, because with this disease process, you got that extra plaque that's in there, and it's slowing down the blood flow. So if you already have a disease process that's slowing down the blood flow because it has this extra plaque and build up inside of those vessels, if that person also smoked, we just said smoking increases the chances of that blood flow being lessened. So that's just like a double whammy. If someone has PAD, the blood flow is going to be slow. And then if they also smoke, that blood flow is going to be slow, even slower. Because smoking causes those vessels to constrict. And you already got that fat and stuff in the vessels. So a person that has a blood clot in the leg, when we go to assess them, or that's subjective and objective information, what will we see? Or what might they say? Okay. So they may complain of that pain. We may see the edema. They may even say that this leg is swollen up and it's red to touch. Does reducing crowded living conditions prevent the spread of tuberculosis? If tuberculosis was in an area, homeless shelter, or just a home where there's, crowded living conditions, would decreasing or reducing help? Okay. Smallpox lesions are seen where on the body? When we talked about smallpox and chickenpox, smallpox specifically are found on these places where chickenpox are not. Because sometimes they're vesicles, we kind of get them mixed up a little bit, but once we look, like, wait a minute, they're found here and here. This is not chickenpox, this is smallpox. Palms of the hands and the soles of the feet. Yes. For sure. That's going to be smallpox. That's going to be the difference. Water can be rendered safe for drinking by removing it from hot water heaters. Is the water in the hot water heater, has it been used, or is it clean and ready to be used? So if that is the case, if it's clean, has not been used, can we use that water for drinking if we need to? Remember we said water heaters and the other place. I don't know if it's on one of these slides. Water can be rendered safe for drinking without boiling. Is this true or false? Does it matter that we boil it? Look for those key terms that changes the whole statement. Okay. With boiling, it should say with, so that without is false. Okay. Water can be rendered safe for drinking by treating it with household bleach and lemon juice. Test taking tip. I'll wait till you all answer to give that tip. Remember, an answer choice has to be all the way correct. Which part of this answer choice makes this false?
Lemon juice.
The lemon juice. The lemon juice. We can use household bleach. Remember, I said the 1 cc or the 16 drops. We can use that. But lemon juice is what makes this incorrect. So when you're reading the answer choice, make sure that the entire answer choice is correct. Okay, because it is only partially correct. We don't select it. Water is rendered safe for drinking by allowing water to sit for 24 hours, pouring water through layers of cotton towels. Does this make water safe for drinking? Yes or no? And it does not. Okay. Appearance of HIV antibodies can take up to 12 weeks or 3 months. This test could be negative now, but positive in 3 months. What do we know about those HIV antibodies? Do they show up right away? It takes the 3 months. So we want to encourage that person to go continue to test. Contact precautions, hand hygiene and gloves, dispose soil contents in a securely tied plastic bag. Do these things equal contact precautions? Washing our hands, using hand sanitizer, putting on gloves, disposing soil contents in securely tied plastic bags. So yes. So if we have a person that has wound care and they go home, we teach them to, of course, wash their hands, put on the gloves, and then the soil contents. They don't need to just throw them in the garbage can. They need to tie them up in a bag and then place that bag in the garbage can. It decreases the risk of contact, someone coming in contact with it and causing them to be ill. Airborne precautions. What is this? What are some things that we need to do if someone is on airborne precautions? Do we need to do anything differently? Is there anything that we should wear? Okay. So usually this person is in a private room. That's preferred. We do encourage them to stay in their room. Not sure who it is, but then put you on mute. Remember, these sessions are recorded. You all won't pick up anything that we shouldn't. And then if we do know that they have to go out for some tests, and so they will wear a mask. And then if we're taking care of those individual, anyone that enters that room, they need to not just wear a regular mask. The mask is called an N95 particulate filter respirator. Okay. Which disease is airborne precautions used for? Okay, TB or tuberculosis. Okay. What measures can decrease healthcare associated infections? Lessens the chance. What can we do to decrease? Okay, of course, we talked about the single most thing is that hand hygiene, using that personal protective equipment, and then properly using it. Making sure that, especially if you have and I don't see them very often, those masks where you have to actually tie, making sure that you tie it so that it's securely on your face. And then those environmental infection control measures, making sure the environmental group are coming around. They're part of their healthcare team too, making sure that they're making their rounds and cleaning objects and things as they should, and that we are as well. A patient should call to report any pain with fever. A person, this is a different person that just may have pain, but they also have fever. Fever is that thing that we need to call. They need to follow up on. They need to go and follow with their healthcare provider because it's something else going on. That's the indication that it's more than just pain. All right. Are there any questions about any of the content? Let me stop this little thing from playing. In the content that we just went over. I don't think we'll have time to go through our cards. It's just a different way of looking at it. So are there any questions? So if the smallpox are found where?
Palms of the hand,
Soles of the feet.
soles of the feet.
Okay. Is that something that is reportable or not?
Yeah.
Yes, it is. So we will have to notify the authorities. So that's the same thing as being reportable. When we're saying a disease process is reportable, that means we're making that contact with those appropriate authorities, to let them know that, the signs and symptoms that we're seeing indicate smallpox. And so that's a whole different, then we go into that level of preventing precaution and, making people aware, that we need to do, differently. Of course, our PPE is at a minimum. But if we're thinking that even if you're at school, you're the school nurse or you're in that industry, that environment, that occupational nurse, and they're coming to you and you're seeing these signs and symptoms, we don't know because we don't diagnose. But if we're seeing them on the soles of the feet and palms of the hand and have those little vesicles, we need to be reporting it. In addition to that, even if you're at that school nurse and you're at that industry and you have an increased number of people having the same symptoms within a certain time span, you have to report that as well. And that is just notifying the authorities, which is usually your health departments in the local doctor's offices. If a person has pain, is that something that they need to just follow up with? Or if a person has pain and fever, is that which one, they can maybe kind of wait around with? Which one should they not? Which scenario?
And fever.
Pain and fever, they need to be reporting that to their healthcare provider. They need to be following up. Okay. So if a person has been infected with the HIV virus and they test in 4 months, should they go with those test results or the test that they took on the day that they thought they had been exposed?
The 4 months.
Yeah, 4 months.
Okay, because we know it takes at least 12 weeks, which is at least 3 months before those antibodies actually show up. And so we want to encourage them to do the repeating the testing. We hope it's negative, but just to make sure. So primary prevention is what? What are we doing with what is primary prevention's main goal?
Preventing
Information to prevent any catastrophe disease or sickness.
Okay. So if we're talking about tuberculosis, because we know it's airborne and we have we'll just say we're the nurse at the homeless shelter, or if we are called in to speak to the employer that employs people that live in their housing that might be crowded. What is something that we can tell them or educate them about to decrease primary prevention, the chances of tuberculosis being spread?
Isolation, not proper mask, distance, not use the same utensils.
What else? What else? What about decrease telling them to, hey, you need to get more housing, those crowded living conditions, because if there is one person that has the active tuberculosis, the chances of everyone getting infected is really, really going to be high. So just having that conversation of getting them to understand, hey, even homeless shelters, we need you all to stick to whatever your number is, and maybe we need to talk to our politicians or whomever, organizations, our private, for-profit, non-profit organizations about, creating more opportunities for people to have places to stay, because just because we have one homeless shelter, that's not enough to house people in the event that something happens in that community, because we know that crowded living conditions increases the risk of someone for when we're talking about tuberculosis being spread. So we would need to have a conversation about crowded living conditions. Just providing that information, that one thing in itself, it can prevent from someone for it being spread in the event that someone has it. So we talked about chronic obstructive pulmonary disease, COPD. That person is having a problem with gas exchange. The respiratory system is mostly affected. So that person is trying to just make sure that their next breath is full, that chest rise and fall. So they're more focused on that next breath. So when it comes to eating or even driving or just doing activities of daily living, their number one goal is taking that next breath. So we need to just be thinking about what can we do, or what can that person do to lessen them getting tired, or making sure that they eat all the nutrients, they get all their nutrients from their meals. We want them to, before they eat, they need to stop and rest. You know, before they start their bath, they need to make sure that they have everything in reach or available, so that they can finish those tasks and be able to live as independent as possible, because their main focus is on just getting that next breath. So we might not think about um, resting before a meal, or making or having smaller meals throughout the day, because we're not, our number one goal is, we're not even focused on breathing because we're not having a problem with it, but because we know that that disease process affects breathing, then we have to change our thinking. Well, wait a minute, this person's thinking about breathing, so what are those things that they can do to lessen the demand for on the respiratory system? And believe it or not, those smaller meals, resting before they go and do certain things, those type of interventions, they really, really help. They really do help. So, home, when we're going into our patients' homes, we want to make sure things are safe so that they don't fall. We talk about falls all the time, whether or not you're in the hospital, no matter what setting you're in, we don't want anyone to fall. So we want to always be assessing that environment, making sure those store rugs to have those non-slid paddings up under. If they're walking, they need to have on those gripper shoes, those non-slid shoes. So, and then also we need to think about, how are they walking? What is their gait? Are they needing a cane crutch or a walker? Are they holding on to things? Is that gait steady or unsteady? So we need to evaluate that gait, and to make that decision. We talked about hypertension briefly. So you told me that on the Kahoot, asked you about what kind of diet would we encourage salt, or more than likely that person would be on a no added salt diet, or they would be encouraged to decrease the salt intake. So now let's apply what we know. What kind of food items would we want them to avoid? Things that have high salt content. So think about canned foods. That's how those foods are kept in those cans for years and years and years, because that salt is that preservative. But because a person has hypertension and that salt can raise that blood pressure, we want to provide that education to help them manage that blood pressure. Not only doing those blood pressure checks, writing down those logs, but also watch what you're eating. Well, what is it that I need to watch? The salt content in food. So we have them to read those food labels. All right, are there any questions? Let me get this quiz ready. We'll be ready to take it. Are there any questions? Got a few more minutes. I can answer questions. Do not click on the quiz just yet. Let me get it set up. Let me get it set up. Okay, so the quiz is available. Let me put the password in the chat. Remember, you do have the 15 minutes to take the quiz. Let me go back and get the password. It is case sensitive. So there are some capital letters and some lowercase letters. There are some numbers. Okay, I'm going to go on mute. If there are any questions, please place them in the chat. You do have 15 minutes to take the quiz, and we have not taken our break. So then once you finish with the quiz, we're officially finished because that will put us at our 9:30 mark, our 10:30 mark, and then our break will be thereafter. So once you finish the quiz, you can log off. Make sure you read each question, think about it before selecting the answer.
Are you gonna post the quiz password?
I am.
Thank you.
So if there are any questions after I post the password and I go on mute, please place a message in the chat. Remember, you can find the quiz in the modules or the grade book. These are usually the questions that you all usually have. And here we go. I know I'm interrupting you, but make sure that you're on camera. You all, these sessions are recorded, so make sure that you're in view because we don't want your quiz to be null and void. So our next set of concepts are home care, community resources, case management, and care of complex chronic illnesses in the community. Home care. Home health differs from other areas of healthcare in that the healthcare providers practice in the client's environment. You are actually in their home. But we still give that individualized care to our clients. Traditional home health care is illness-related care for individuals and their families in the home setting. Home care includes home visits by public health nurses and population nurses for primary and secondary prevention. Home health nurses empower patients and families by providing training, education, and nursing care through transition periods, even if they have been newly diagnosed. Because home health care is often intermittent, meaning that we're not there 24/7 every day. We want those patients to become as independent as possible. Because home health care is often intermittent, and because of the reliance on others, it's not always possible over long term. A primary objective for the nurse is to facilitate self-care so that clients may remain in their home. This allows clients to have control over their life and can help prevent hopelessness and loss of self-esteem. Although assistance may be needed, such as from a private duty nurse, the home care nurse, or family members, this assistance should come after helping the clients help themselves. So we want to encourage them to be as independent, as safe as possible, because we're not there all the time. The nursing assessment may take longer for home health nurses because when working in clients' home, we're the guest and we have to establish that trusting relationship with them. So it may take a little bit of time before we get that trust. They may have to have a conversation with us, and then they'll begin to open up. The Omaha system is used by community-based nurses for documentation. It helps us to organize, sort, and document all the pertinent client data. This system was developed by a visiting nurses association in Omaha. That's OMAHA. And it's based on home nursing documentation needs. So this system specifically matches everything that is needed or required for that home health documentation. The Omaha system is most relevant to home health nursing and is most typically used by home health nurses. That's that Omaha system. The responsibilities and functions of healthcare professions in home care are dictated by Medicare regulations, professional organizations, and a state licensing board. Many of these services can be provided on consulting basis. The plan of care should be implemented and reinforced by all involved disciplines. Therefore, interdisciplinary collaboration is required in that home health setting. So we want to talk to everybody on the healthcare team. We want to share that information. That information should be shared from one provider to the other. Especially the client is transitioning from the hospital and they're going home. We need the hospital staff and the home health agencies. They need to talk and have that conversation so that there is a continuity of care. The introduction to Medicare led to the emphasis of home care nurses caring for acutely ill clients. That increased. So as a result of that, they need that documentation. And so the Omaha system was created to assist us in making sure that we address all the documentation requirements, information that is needed so that Medicare can pay for those services. The incentives and pressures for cost control and improved health outcomes have increased. And so we've had a development of telehealth technology that's been implemented in home care. To prevent falls, the environment should be well lit. Night lights should be used if is necessary. Other factors in assessing include removing loose scattered rugs, removing spills. We may have to, they may have to even have handrails installed or either grab bars if they're appropriate. If the client is in a wheelchair and is at risk for falling when they try to get up, a waist belt training might be necessary. Waist belt training might be necessary. So community resources are used to enhance self-care capacity. The first step in building trust with a largely non-English speaking population would be to identify that trusted community leader. That leader can be a person of faith. It can be the PTO president, but we want to identify that trusted community leader and ask them to help us to develop that plan. In developing information to effectively reach the non-English speaking community of recent immigrants, we should ask that community leader if they would translate for us and to assist us in developing messages that we're going to be using to relay information to that population. Case management involves activities implemented in individual clients in the system. Case management programs are typically for high-cost chronic diseases among populations such as people that have asthma, diabetes, COPD, and cirrhosis. Case management can be labor-intensive, time-consuming, and costly because of the increasing number of clients with complex problems in nurses' caseloads. The intensity and duration of activities required to support the case management function may soon exceed the demands that the direct caregiver can meet. Because case management is labor-intensive and costly, it is unrealistic for all clients to have a case manager. Although additional clients could benefit from case management. Nurses fulfill roles as the advocate, we're the care coordinator, and we're the referral agent, which are all necessary, all functions of the case manager. A particularly challenging problem with case management is fragmenting of services, which can result in overuse, underuse, gaps in care, and also miscommunication. So clients who have a primary care provider typically know that provider. They know who that person is. Case management competencies requires the following knowledge and skills: knowledge of community resources, financing methods. They have to have written and oral communication and documentation skills. They should be able to critically think. Case management requires varied types of communications. In collaborating, an individual attempts to work with others towards solutions that satisfies both parties. That is collaborating. Assertiveness is the ability to present one's own needs. Cooperation is the ability to understand and meet the needs of others. When compromising, an individual attempts to find a mutually acceptable solution that partially satisfies both parties. So we need to know compromising, collaborating, and cooperation. Post-op care. We need to be thinking about airway, breathing, and circulation, safety, pain. Be thinking about what are some potential complications. What assessments should we be focused on? How do we prevent complications? Aseptic technique, changing dresses, turning, cough, deep breathing, encouraging the use of the Excentus barometer. Encourage oral intake if it's not contraindicated. Delegating care of an unlicensed assistive personnel during the post-op period should give specific instructions as what is to be done. Instruct how the task is to be done, We need to list information that needs to be reported and be aware that the nurse is responsible for the outcome of the care that is delegated. The LPN would not assign a client who is unstable. We would not assign, delegate. If that client is unstable, we would not. Cirrhosis causes, some causes of cirrhosis is alcoholism, hepatitis B and C, and non-alcoholic fatty liver disease. The people, some signs and symptoms, they will experience fatigue, weakness, abdominal pain, nausea, and vomiting. They are high risk for bleeding and bruising due to vitamin K deficiency. Itching, pruritus is a very common signs and symptom because they have the buildup of those toxins. So interventions, sodium and fluid restrictions. That person might be on a diuretic. We want to tell them to monitor for GI bleeding, looking for dark tarry stools, blood in their their vomitus if they actually vomit. A person might need to be on daily weights. Okay, we talked about COPD. If that person is smoking, we want to encourage them to stop smoking, reduce air pollution exposure. Oxygen therapy is used to treat it. The goal for the O2 sats are 88 to 92%. Our norm is 95% and above. If someone has COPD, the goal for those oxygen saturations are less. They're between 88 and 92%. We want those individuals to rest before eating. Avoid lying down for an hour after eating. And tell them that overeating will cause distended abdomen. So we do want to have them to increase their protein and calorie consumption. So they may have to have frequent smaller meals. Okay. Diabetes is characterized by insulin resistance. Symptoms. We have those recurring infections, poor wound healing, and initially they may lose weight prior to treatment. Early diabetes and pre-diabetes are reversible with weight loss, dietary modifications, regular exercise, and stress reduction techniques. All patients with diabetes benefit from these interventions also. Atherosclerosis of peripheral arteries lead to decreased blood flow in the extremities. It commonly affects the carotid arteries and the lower extremity arteries. In the legs, it causes intermittent claudication. That person will have pain at rest, tight pressure in their calves and buttocks. Necrosis, gangrene can also occur. Ulcers are slow to heal, so we're going to make sure they're not getting any injuries. Ulcers with PAD or peripheral artery disease are usually round, symmetrical, and smooth. Someone with PAD can suddenly experience a thrombus, which can cause signs and symptoms would be pain. We will feel and there's no pulse there. They may have pallor, and they may be, feeling. They may not even feel that extremity. May feel like paralysis. We want them to walk regularly. That improves circulation. If they are smoking, we need them to stop smoking. Smoking cessation. Avoid compression of the extremities, including constrictive clothing. Raising the bed at the knees. Sitting with the pillow under their knees. We want them to keep their extremities below the level of the heart. That improves circulation as well. Chronic venous insufficiency. Valves in the veins do not close normally, preventing venous blood return out of the extremities back to the vena cava of the heart. This causes swelling in the lower extremities. Pressure builds up in those vessels, causing those red blood cells to leak out into the skin. And then that skin will start to have a brownish discoloration. The skin is usually scaly and itchy as well. Ulcers are common and are usually near the ankles. Some interventions is compression stockings, compression bandages on the ulcers, stop smoking, smoking cessation, and raise those extremities above the level of the heart. They need to improve the hypertension, their blood pressure, and their diabetes. Hypertension is where the systolic is greater than 130 and the diastolic is greater than 80. Diastolic is usually the focus of the treatment. Systolically, 120 to 129 is considered elevated. We want to encourage our patients to modify that diet, start to exercise, start to lose weight. And if they're smoking, stop smoking. Once that blood pressure gets in like those 130s over 80s, then the doctor may also add a medication, antihypertensive. Blood pressure is a measure of the pressure exerted on blood vessels. When the heart pumps, that's systolic. And then when the heart rests, it's diastolic. Our interventions, we want to monitor for and provide education related to orthostatic hypertension. We want to encourage them to rise slowly, change position slowly. Avoid getting up for 30 to 60 minutes after eating when blood pressure tends to drop anyways. They need to decrease that sodium in their diet. They need to start reading food labels. Want to include a routine exercise. They need to start making those dietary changes so they can have weight loss, stop smoking, and they want to be careful with caffeine and stimulants. We want to impact, no matter what the disease process, we want to empower our clients to, with self-care capacity through providing them information and so that they can gain understanding. So they can at least have an understanding of the disease process and the things they need to do to manage it.